The latest in my series of collaborations with CycleFit's Phil Cavell involves 3 experts with advice for the older athlete. The interviewer is Phil Cavell, author of the best-selling book The Midlife Cyclist, who, as explained in this video, now has a pacemaker due to ignoring previous cardiac warning signs. Dr. David Hulse, consultant in sports medicine, team doctor for EF Education. He had a heart attack in 2020 and a coronary artery bypass graft. We can all learn from his textbook recovery. Dr. Nigel Stevens, one of the UK's top sports cardiologist, guest on 2 previous videos and himself an elite-level master cyclist. He was walking to his clinic, saw we were recording and knocked on the door. In the other part of this interview, Dr. Hulse explains what the ageing amateurs he treats should learn from the pros he also works with. Now we'll hear how he put his medical expertise into his own recovery.
I am in overall better shape now than I was before the event, and that's for a number of reasons, for a number of lifestyle reasons, or a number of change of lifestyle reasons. There's Nigel. Shall we,
let the pause.
Let him in.
Hello.
I'm in. Swing things around to call in. Hello.
See you. Hello.
Nice to see you.
Hi.
Shall I switch everything off?
I'm sorry to interrupt.
You're not in worry.
If you were doing this.
We've just started.
Well,
Please stick with this. It's helpful, but it's also very funny and entirely unscripted.
So where am I going from? Right from the start.
Again from
Fine.
the top.
So David, this module is called Grow Old, Ride Fast, Don't Die, on the back of the book. And of course you helped me with this book a great deal, but right at the end you're featured on page 268 as a case study number 2, heart attack, Dr. David Hulse. So after helping me with this book, right at the point I was writing it, you then went and had a heart attack, and I got a text from St George's Hospital. I'm in St George's, I've had a heart attack.
One of the great ironies.
One of the great ironies.
Of the writing of the book.
On top of my own great irony.
Yeah.
And if only at this point we had a sort of friendly cardiologist to turn to and explore the theme a little bit with. Nigel.
yes.
So lovely that
I was walking past.
Literally.
So lovely that you've wandered in. So Dave, I mean, please, it was the start of COVID. It was a scary time anyway. And as a 49-year-old cyclist, doctor, you suddenly had this heart attack.
Yes, it was unexpected. I think in the small piece that I wrote for the end of the book, that mortality greets us in many ways, and mine was an unexpected heart attack. I wasn't known to have any heart disease. I was a 49-year-old cyclist and father of 2, otherwise completely fit and well, and yes, had an acute heart attack in the middle of February 2020.
And so then you hung out at St George's for I think 10 days, and then they wheeled you down and gave you a triple bypass surgery, which to anyone like me sounds like that's the start of the end, isn't it? But it wasn't. And then quite soon after we went for a ride and you were fine. And so as a corollary to the discussion that I had with Nigel, where is what can somebody expect day 0 or day -1, you're kind of the poster boy that you've come back to even better health, more fitness. Is that right?
Yes, I suppose so. I mean, I often think that I was quite lucky, and I had what turned out to be quite a mild heart attack. There was no lasting damage to the heart. Subsequent scans have shown no scarring or permanent injury to the heart. So in a sense, I was lucky. I survived my event. Some men in middle age don't survive their first event. So I feel fortunate. I was treated with, as you say, an urgent heart bypass, which was done about 10 days after the event. And yes, day 0, waking up in cardiac intensive care after that major surgery was the start of A couple of things, really. Firstly, getting back, rehabilitating me and my heart back to what I wanted to be doing, which was largely cycling, but being physically active and being, present.
Yeah.
But also there were some why me questions. There were a number of why me questions in perhaps the months and years following, which I think was understandable.
Yes.
But yes, I have got back to complete normality in terms of what I'm able to do. I have no symptoms. I ride my bike. I can ride my bike and run at high intensities without any problem that I'm aware of.
Yeah. So, Nigel, was David saved by ischemic preconditioning, do we think, to pick up one of the conversations you and I had?
Well, I'm not his cardiologist, Phil, so I may not know all of the story, but I know enough of it. So, no, I think he was saved by, as he puts it, being lucky. So there's actually a grey zone between angina and a heart attack. In the traditional way that we would think about a heart attack is blockage of a major artery and death of a major portion of the heart muscle. But actually the grey zone is people who often have a severe narrowing of which they were unaware. A small blood clot may form in it, or the biology of the narrowing may change, and you get symptoms and you get a little bit of evidence of heart damage on the blood tests, but as he says, not a lot. So really what he had was quite a fortunate warning, albeit that he was unlucky to have the heart attack itself. And so if we sort of scroll forward to his recovery and thinking about people after they've got over the physical sort of trauma of the surgery, you've got two things that are important. Number one is the heart damage to any significant degree, which it was not. And the second is the heart's blood supply good, and is there likelihood of further issues? Because some people, you've got narrowings which have been effectively bypassed with a very good blood supply with a low probability of future trouble. But you've got other folk whose arteries are diseased from stem to stern, and even if they've had an initially successful bypass, you're much more chary, much more cautious about how much you should put that heart through afterwards. So there's a big spectrum between people like him, who I'm sure can probably perform better than he did before, in fact, with the weight loss as well.
Thank you, Nigel.
No problem. And partly, and all the way through to people who can still get the benefits of physical exercise, but that's very much more the health benefits. And so that's 2.5 hours a week of zone 1, low zone 2, not pushing into anaerobic and sort of physiologically stressful training zones.
Yeah. And that correlates with your experience, I suppose, does it?
Yes, it does, exactly. Yeah.
And one of the other things that Nigel and I were talking about from the last podcast was that we were proselytizing about abstaining from alcohol, and in fact pretty soon after the surgery, around that time, you gave up with alcohol as well, I think, didn't you?
Yes, it was a couple of years after, and from the previous podcast you had talked about the cardiac risk of alcohol and alcohol as a poison that the body has to deal with.
Well, I think we quoted you actually.
You did, and yes, it was I decided to stop drinking alcohol for a number of reasons, the cardiac reason being one of them. But it has also had clear benefits in terms of health in all its forms, and I would say also exercise and my exercise capacity.
Good, excellent.
All right, so I'm jumping in rudely. Alcohol versus the heart, which, as you said, we did talk about before. And sometimes when you see people after a major cardiac event, they're very keen to do everything that is good for them, and particularly good for the health of their blood vessels. And so they say, I've stopped smoking, well done, and I've stopped drinking. And then it gets a little bit more tangled and complicated, actually. So people who abuse alcohol and who subsequently have an autopsy generally have quite clean arteries. So whatever other things that it do that aren't good for our health actually vascular disease ain't one of them. And it also gets tangled up, I think, with the sort of marketing around alcoholic drinks, you know, and about whether red wine contains beneficial antioxidants, etc., etc. So when I'm talking to people about alcohol versus the heart, I say it's a toxin almost certainly beyond 7 units a week. It certainly increases your chances of atrial fibrillation, and in people who are genetically vulnerable, it may increase the chances of heart muscle disease, alcoholic cardiomyopathy. So I think for Dave, in this context, giving up alcohol is definitely beneficial for weight control. Everyone says that. It's definitely beneficial for athletic performance, and it's definitely neutral as far as the long-term health of his bypasses is concerned.
Right, okay, fine. Nice qualification.
Great stuff.
Very good.
Shall I leave you guys to talk?
It's an interesting one, isn't it? Because, alcohol also has a social context.
So complex, yes.
People often ask me why I stopped drinking alcohol.
Right.
And, I explain the reasons why, but I always feel slightly reticent about sounding preachy or sounding evangelical about abstinence, because it does have a social context.
That's right.
And despite the fact that it is chemically a poison,
it's socially lubricant.
It's a social lubricant, and perhaps across the board, perhaps the social interaction that goes on with it, the friendship, the support, and so on and so forth. Sometimes,
yes,
sometimes we ignore that.
At 10:30, everyone else is boring because they're slightly tipsy, and you'll go on going to bed.
Yeah.
But the world's changing. So my mother, when they entertained at home, if somebody said, "Oh no, thanks," she was on a mission. She was going to foist a drink onto that person, and that was the vibe. I think as somebody who hasn't drunk alcohol for more than 25 years, I've noticed the difference in social interactions now. My adult children don't drink alcohol, and within their peer group, that seems to be more normalized. Yeah. And even among people of our age, now there's a significant chunk of people in the room who don't drink. So I think the world's changing in the way that it thinks about it.
Yeah, and it might be, and probably is, the fact that we've all come to that decision for different reasons.
Aye.
And that's the thing, isn't it? We're all not drinking for different reasons, but they're all good reasons. But I think the unifying thing is that once you've severed the alcohol, I don't think anybody would ever go backwards.
No, it's a no-brainer, isn't it?
Once you're free of it, it's like, oh, what was I?
Yes, I know. And I was making up nonsense about all the bouquet and all. And I'm sure it's real, all that connoisseurship, but it is all just a psychological device to drink red wine.
And then when you are in that kind of social environment, and it's a great night, and everyone's having a great meal, and it's one of those sort of memory nights, it doesn't actually make it any less a memory night if you're the only one not drinking. And very, very often in my social environment, I'm the only one not drinking. It doesn't make it any less memorable. No. That, where I've got to drink to share in it, it's just nonsense, isn't it?
Yes, it is. My mother was wrong. She was right.
She was absolutely wrong.
She was right about many things.
But she sounds a good
Bless
thought.
her memory.
She sounds a good thought.
She was great. She was the same with smoke.
She made you all smoke.
You will. And if she found somebody who'd given up smoking, she'd go, and you will, come on.
Did she have a cigarette case?
Yeah.
Wow.
We had a silver.
Lovely.
Right, look, I better leave you guys to it. I'm
Thank
sorry
you for,
to
no.
ambush your conversation.
Lovely to see you, Nigel.
Nice to see you too, David.
And there's more. If you haven't already, please check out Phil's previous videos with Dr. Stevens, as they are packed with practical information for older athletes.
Goodbye. Very good to see you again. All right, so we've lost Nigel. David, that was very fortuitous.
He's gone to do a clinic.
He has to go past Store Street to get to his clinic at ISCH. So we've lost Nigel. That was genuinely just a fortuitous moment.
Yeah.
Fantastic. What did you? I mean, we kind of just press ganged you there. What's your takeaway from that conversation Nigel, who you know, by the way, don't you?
Nigel's always fascinating because of his special interest in middle-aged athletes, really, and the level that he rides at. He has a very special degree of knowledge about.
Yes, he's our talisman, isn't he?
Absolutely. Yes, it was interesting hearing what he was saying about the different types of plaque that appear in coronary arteries, and you and he talked about this in the previous podcast. I mean, on a personal level, I can't really say what type was there and how the event happened. We don't have that information, but what I can say is that the angiogram, so the investigation to look at my coronary arteries, which was done after the heart attack, showed some areas of narrowing, and ultimately they were the cause of the problem in various degrees, and that what the cardiologists observed as to the pattern of narrowings, which arteries were affected, then determined that the heart bypass was going to be the best type of treatment for me, and that's how the surgery came about, rather than perhaps having a stenting type of procedure.
Right.
A coronary artery bypass graft is a major operation, and Dr. Hulse underwent his just before COVID. His recovery period was with family in the Scottish Highlands. In the Midlife Cyclist book, Dr. Hulse is one of the case studies, and it's worth a read, partly because Phil and Dave have been friends for decades. Within 4 months, they were in Richmond Park, riding together with Dave at the head of the pack.
I admit to getting back on a bike 6 weeks after the operation. I was given permission to do it by the cardiac rehab team, though perhaps in reality they weren't quite aware what was involved. But yes, it was then began a slow process of regular exercise, it started off as daily walking and daily fresh air in a very rural environment as it happened. And rapidly progressed to getting back on a bike, and very slowly, and I hope sensibly, building up, I'm not going to say intensity, but building up the amount of riding and enjoying having come out of the other side of it. I think that was a big factor in all of this, which I think I allude to in the book. There was a lot of reflection in having come out the other side, having woken up on day zero and then moved forward. What we then get into after an event, a cardiac event like this, is what's called secondary prevention, which is the lifestyle changes and some medication which are then aimed at preventing the event that happened before, preventing or reducing the risk of it happening again, conditioning the heart to be able to cope with the insults that life and genetics throw at it. One of the issues that we have to contend with is how our genetics have influenced our health and our risk factors in terms of developing ill health of various forms. And it's an important area in looking after or treating midlife athletes who come into clinics with health-related problems.
Some of those problems are discussed in this earlier video, in particular how older athletes can adapt their training as their body ages, plus manage allostatic load, the hidden stress in all our lives. Seek it out if you haven't seen it already, and there are more great videos in the Older Athlete series here.